Another COVID-19 vaccine appears to be promising. Moderna says its vaccine is 94.5% effective against the virus. That is brand new information this morning. That's according to early data from the company's ongoing study. This comes after Pfizer announced that its vaccine was over 90% effective. This could put both vaccines on the fast track to emergency use in the U.S. if they get FDA approval. Moderna says it expects to have about 20 million doses ready by the end of the year.
Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Talk about the procedure to make sure that these vaccines are safe, even though they may be fast-tracked. What is that process? What are they looking for?
Yeah, so this data that we've seen in a press release today is very encouraging. 94.5%. We were going to say it's good if it was over 60%. 50% even. And this is the second vaccine that's 90% or better. Now, that's just the gross number of people who've been protected who were taking the vaccine compared to placebo. This is why we need these placebo-controlled studies. Now, what will happen is we need to look at why the people who weren't successful, who took the vaccine and got sick, why that happened, who that group is. Are they the older people or sicker people, or did they have diabetes or something like that? So it has to look at very closely. The other thing that has to be looked at is any kind of adverse effects from the vaccine. It was reported that people that were taking this vaccine knew they took the vaccine because they just felt it. This has been with both of these, Pfizer and the Moderna one. So we need to look very closely at the side effects. So the FDA will look at that. There's an external advisory panel that will look at it. The data will be made supposedly completely public and transparent, and then people can make a decision.
It's still very low numbers of people saying that they would take a vaccine. I don't know if that'll be adjusted when they hear 94% effective, but a lot of people worried about side effects. What could side effects be, and how long until we get rid of those?
Well, with other vaccines, the side effects have been long-term side effects. A lot of them have been neurologic. We had the transverse myelitis case. We thought, where the person got partially paralyzed. We've had
that sounds scary.
That's very scary. It's very scary. And we had Guillain-Barré with the influenza vaccine. It's these immunologic reactions that are causing these other things in the body that is independent from the immunologic reaction you want to see against COVID. So that has to be looked at very closely. And these patients in the studies have to be followed for a long period of time. That's what normally we do that for years. Here we're talking about months because we're in a pandemic. We had 1 million cases in the last 6 days.
Right. So that's
until the end of January. There's going to be that means if it's exponentially growing, 20 million more cases.
The question people have: if you ideally would follow them for years to see what long-term effects would be if they're as scary as those, does it concern you that people would not take it if it's only going to be tested for 2, 3, 4 months?
Yeah, and that's why the surveys that have been done are that half the people they're afraid to take the vaccine. So we've got to be very transparent. The data will be rolling out over time. So, they're going to have 20 million doses of the Moderna one by the end of December. So that means January, somebody's going to start getting the vaccine. They have to have 2 doses, so that's 10 million people there. Pfizer, about the same. They're going to have 40 million doses, so that's 20 million people. So that'll go out to the people in the front lines, the high-risk people with underlying diseases like diabetes, heart disease, and lung disease. So it'll roll out a little slowly in the first couple of months. Plus, delivering this stuff with the cold chain supply that they've got is going to be challenging too. But we can get over that. So then, as that data piles up in these other 40,000 people in the Pfizer group and 30,000 in the Moderna group, every month that's tens of thousands of experiences of side effects. So, by the time it's going to get out into the general population, which is the second quarter of 2021, so April, you're going to have an awful lot of safety data available.
All right. Quick question here from a viewer. I'm hearing about quite a few people who have gone through COVID and resumed normal life, suddenly having symptoms again. It happened to my daughter 90 days from her original diagnosis. She was tested and retested, I should say, and was negative. But if it was a COVID resurgence, would she have been contagious?
This is a very scary question because we don't really know the answer. The preliminary data, and we're learning more about this every day, especially with the numbers the way they are, that COVID does a lot of damage to the lungs, to the heart, other parts of the body, to the brain. And, you know, this woman, the daughter, got over the COVID. COVID is gone. What she's suffering from now, most likely, I can't prove it. I'm not taking care of the woman. I haven't evaluated her. But most likely it's from the damage that the virus had done already. It's not from a new infection. It's from the damage that's done. And this is, you know, we know 10% of these people that get infected, young people too, in their 20s and everything, have this long hauler thing. They have side effects for up to 6 months. And, you know, there's a lot we need to learn about this viral disease.
All right, Dr. Murphy, thanks for checking in again. You can go to our Morning News Facebook page if you'd like to post a question for him. We'll talk to him again tomorrow. Thanks again.
Great. Have a good